Measles can cause blindness, brain damage, and even death.
Cases of measles in Europe have reached the highest this decade, according to the World Health Organization. 3 years ago, there were just over 5,000 cases of the disease. Last year, there were 24,000. Now, the numbers have risen to 41,000, and that's just 6 months into the year.
Some people think measles is just a rash, but the problem is it can be so much more than that. It can lead to really serious complications, things like brain swelling, meningitis, blindness, and liver problems, to name just a few.
Experts blame this surge in measles infections on a drop in the number of people being vaccinated, and the World Health Organization is calling on European countries to take action. So why aren't people getting vaccinated?
In some ways, vaccines may have become a victim of their own success. Because they're working so well, doing what they're supposed to do, maybe people aren't seeing the serious complications of things like measles anymore, and maybe then thinking, this isn't a serious disease, why would I need a vaccine? But that couldn't be further from the truth.
Dr. Wakefield cares about our children!
Another obstacle to vaccination is the anti-vaccine movement. Around for centuries, but bolstered in the late 90s when gastroenterologist Andrew Wakefield made a baseless and disproven link between the combined measles, mumps and rubella jab and autism.
20 years ago, some now completely discredited research published in the Lancet Medical Journal, which looked at just 12 children, sparked fears that the MMR vaccine may somehow be linked to childhood behavioural issues, autism. The vast, overwhelming majority of scientists and medics around the world say this is completely wrong, and there has now been loads of research to show there is no link. In fact, Andrew Wakefield was later struck off from the medical register, and the Lancet withdrew the study and said it shouldn't have been published.
But it did add fuel to the anti-vaccination movement, and there are experts that say that because of this information, lots of children around the world were not vaccinated, and some got measles as a consequence. But the anti-vaccine movement is as old as, well, vaccines. And since the 18th century, the subject was fertile ground for conspiracy theories reflecting a distrust of the government, fearing it as a tool of the establishment.
The problem is now that social media can spread this bit of misinformation more widely, more quickly, and public health experts are really worried that some parents may just be hearing these more sceptical voices and not hearing the important messages they're putting out, that vaccines can save lives, have been given safely to millions of children worldwide. The World Health Organization says the measles vaccine alone saved more than 20 million lives in the last 2 decades.
No parent wants to expose their child to unnecessary danger.
Of course, there are many reasons beyond misinformation that people don't use vaccines. Some religious sects discourage such medical intervention. Some groups distrust their government, and some people simply can't get hold of them.
Another reason some communities, some pockets of communities and some countries aren't getting the vaccine is that the infrastructure simply isn't there. The healthcare system isn't set up well enough to provide the vaccine for all the people that need it.
A skepticism of vaccination has been touted by many populist leaders, tapping into an anti-establishment sentiment which resonates with many people. In France, Marine Le Pen of the National Rally Party spoke out against mandatory vaccination. And next door, in Italy, where incidence of the disease has risen from a few hundred cases in 2015 to several thousand cases a year, both parties in the populist coalition pledged to relax vaccine laws, a promise they're looking likely to follow through on.
The issue with vaccines is that they work on a principle of something called herd immunity, and in this case that means that 95% of the population needs to have had the vaccine and have been immunised in order for the community to be fully protected. So some experts say that while choosing not to give a child a vaccine may be an individual choice, this is putting other people, making them vulnerable to a disease, older people, very young people, leaving them at risk of a disease that could ultimately be fatal.
Vaccines are one of the biggest success stories of modern medicine. Experts say they've saved millions of children from devastating childhood diseases. Take the polio virus, which at its peak left 1,000 children a day paralyzed around the world. Or smallpox, which would cause an estimated 2 million deaths every year if it were still around. 37 people have already died from measles in the Europe region this year. That's 37 deaths that could have been prevented with a vaccine.